The Strategic Purchasing Africa Resource Center, SPARC, in collaboration with the Kwame Nkrumah University of Science and Technology, held a policy dialogue to discuss strategic health purchasing in Ghana in December 2021. The dialogue sought to bring together major stakeholders in the delivery of health services as well as well-versed persons in academia and policy formulation. These major stakeholders were from the Ministry of Health, the Ghana Health Service, the National Health Insurance Agency, the Private Health Facilities of Ghana, and the Christian Health and Association of Ghana. Professor Sister Eugenia Ampofu noted that strategic health purchasing ensures efficiency in the use of health resources.
So when you talk about strategic purchasing, we want to make sure that payments is linked to the performance of the provider. This ensures that resources are used efficiently. And again, we want to make sure that the services that are selected for population are aligned with population's health needs. In this case, resources that are so limited are used efficiently, and so you get value for money. It's very important, strategic purchasing.
She also emphasized that the dialogue was not only organized to suggest policies, but to know the country's level and position in healthcare delivery.
Why did KNUST and we put this together? Because we wanted to learn what Ghana has done so far with strategic health purchasing. Ghana is one of the countries in Africa that is spearheading healthcare provision, financial protection of the consumer. And so people need to learn, and of course, Ghana too needs to sit with providers and the purchasers to look at what we have done well so far and what is the way forward and how can we move forward. So every now and then, this kind of policy dialogue is extremely important. We need them.
Mr. Frank Toblu from the private health facilities shared his view on the NHI's cost containment, which dampens the profit of most private health care producers.
Yes, as far as we are concerned, as private healthcare providers across this country, the National Health Insurance Authority is more or less the major source of our revenue. So whatever action or inaction that they do has direct effect or consequence on our facilities. Now, that is to say that they have, over the period, used what we call cost containment. Now, cost containment actually suggests to the fact that they should ensure that they buy our services at a price such that they will not have a challenge in the long term. But the very important question that we have to ask is, in a bid to ensure that they contain costs, does it help the provider also to remain in business in perpetuity? The answer is not clear, because like I said earlier, they come up with a whole lot of health insurance price lists. Like I said, the prices are not reflective of the true situations on the ground, so it has not been helpful to us.
It suggests a clear-cut policy guidelines in medical stores to reflect and enhance strategic purchasing in Ghana.
There are instances they refer us to go to medical stores to procure our products so that we will live within their price list. Trust me, if we go to the medical stores, the very product we're supposed to get from there, we don't get it. The people there will not sell the product to you. They will ask you to go elsewhere to get your products. So when we go out, we go to the open market, for which the prices are higher than what is even on the National Health Insurance list, as I indicated earlier. But what we have to do is to report those behaviors who refuse to give us the product at the medical stores. But we are of the view that that should be a responsibility of the Ministry of Health. It shouldn't be a prerogative of an individual to decide whether or not you should sell to a private hospital or not. It should be a clear-cut policy guidelines that, look, if a private hospital comes here, sell to them.
The dialogue serves as a platform for all stakeholders to bring out their challenges and how to solve them towards a more enhanced and effective health system for the country.